In a situation where the Chinese Communist authorities are demanding a set COVID-19 vaccination rate, there are constant rumors of local governments forcing or even resorting to violence to make people vaccinate. But there are also local governments that adopt incentive policies such as giving out eggs and milk, and even paying $500 to several thousands of dollars per person if they vaccinate. This is a very rare phenomenon for ordinary Chinese people who have never received free medical care. Based on media reports and information exclusively obtained by China Observer from people working within the Chinese government, we found that this vaccination mess exposes a huge problem of falsification in the Chinese census. In late August, the director of a township health center in Zhoucheng, Shandong Province, was taken away by police after he led medical staff from the health center to Zibo City to give vaccinations to the locals. He would even give the people a reward of 1,000 yuan each, which is about $155. The local government in Zibo learned of the incident, which led to the arrest of the director and corresponding disciplinary actions against the rest of the medical staff. According to the inside information we obtained, the health center did so at the request of the local government. And in Zhoucheng City, to encourage people to get vaccinated, each person is rewarded with 1,000 yuan. This policy has led many residents of the surrounding counties to get vaccinated in Zhoucheng. In order to receive this 1,000 yuan reward, many people impersonate those who do not want to be vaccinated and gets vaccinated themselves many times. It is said that an elderly man in the countryside who took the name of someone else in several injection sites and got 5 shots died tragically. Not only that, the Zhoucheng city government also assigned tasks to all local civil servants, where each local civil servant must complete 10 targets, that is, to ask their friends and relatives to get 10 people to vaccinate. The leader also claimed that it does not matter what approach you take. If you cannot complete a task, then do not come to work. Some of the employees directly said they cannot complete the task and will hand in their resignation letters instead. There are also informed sources leaked to foreign media, mentioning that some civil servants really couldn't complete the target, so they pay people to get the vaccination in order to hit their goal. There was also an old man who went to get vaccinated despite his severe rheumatism in order to help his civil servant's son finish his target. The local government did so in order to fulfill the latest internal directive issued by the highest level of the CCP, which is to complete the vaccination target of 1 billion people by the end of August and to achieve 1.1 billion vaccinations by the end of October. According to documents issued by various local governments, this directive was personally reviewed by General Secretary Xi Jinping and is a goal set by the party's Central Committee and State Council. It is the highest political task that must be completed by party members and cadres at all levels. According to the latest census data in 2020, China has a total population of 1.412 billion people. And if 1 billion people are vaccinated, this means that China's vaccination rate has reached over 70%, making China a world leader in vaccination. This would highlight the Communist Party's achievements in fighting the virus and restoring its international reputation, which has hit rock bottom. On September 15th, China announced that it had reported a cumulative total of over 2.1 billion doses of vaccines and over 1 billion completed vaccinations. As soon as the data was released, the Western media immediately reported on it. The New York Times described the data as representing a major achievement and a milestone in achieving mass immunization, while Bloomberg called China a world leader in vaccination. To accomplish this political task, local governments at all levels have issued call-to-action documents or forced people to get vaccinated, preventing them from going to schools, work, or public places if they refused, or, as we said earlier, adopting incentive policies. In addition to fulfilling the tasks assigned by the central government, there is an ulterior motive for governments to force vaccination. It is to cover up the falsification of census data. We learned from a staff member within the system that the CCP authorities claimed the 7th national census figure was 1.412 billion, which is actually false. This is because the population is misreported at all levels, from the provincial, municipal, county, and township levels. Because the population size involves the interest of governments at all levels. For example, the civil service establishment is matched according to the population size, and there are also administrative levels, financial resources, institutional departments set up, all related to the population size. In order to gain more benefits, local officials at all levels who are responsible for counting the population will basically fabricate the numbers. Regarding the statistics on the population, the census from the past few decades were full of false data, and the falsification is especially serious this time. However, the vaccination target was issued based on the false population data from the census, and in order to keep the shady practice of misreporting the population from being exposed, local governments are trying to find ways to make the vaccination rate meet the target. This has led to all kinds of chaos and mandatory vaccination. In fact, the 7th census data was widely questioned by the public when it first came out. Chinese demographer Yi Fuxian, who now lives in the United States, considered the census data to be most unreliable, with 130 million people falsely reported. According to his analysis and research, China's actual population should be less than 1.28 billion in 2020, with negative growth, and the fertility rate is less than 1.1. One of the biggest doubts is that the population aged 0 to 14 does not match the previously announced birth rate. According to the report, the population of 0 to 14-year-olds was 253.38 million, or 17.95%. In other words, that's a total of 253.38 million newborns from 2006 to 2020. According to the birth population data for the calendar years 2006 to 2019, a total of 211.23 million people were born in these 13 years. Even with zero mortality rate, which is basically impossible, the number of newborns in 2020 must reach 42.15 million in order for the data to be true. However, the announced number of births in 2020 is 12 million, so where did the other 30 million children come from? In addition, it's weird that the population over 65 years old in 2020 is 190.64 million, a sudden increase of 14.61 million from 2019, while the previous annual increase in the elderly population was about 9 million. The number of deaths in 2020 is 14.27 million, which means that there must be about 30 million people entering the elderly population group in order to logically achieve the numbers in the census. But that's not possible, because everyone over 65 in 2020 must be born before 1955, when China was in turmoil and unrest, and birth rates were very low. A review of the data shows that the birth rate in 1955 did not increase but plummeted from previous years, with only 20 million births. Also, according to official population figures released by the Chinese Communist Party, the number of deaths in 2020 is 14.27 million, up nearly 5 million from 2019, breaking the record for the last 40 years. Some suspect that this may be related to deaths caused by the coronavirus, although Chinese officials say fatalities only number in the tens of thousands. Yi Fuxian has specialized in China's population for more than a decade. For years, he has been calling for mainland China to quickly eliminate the birth restrictions, and is the author of the book The Great Nation's Empty Nest. The book used to be banned in the mainland, but later the authorities found the population problem was serious and agreed to publish his book, but the CCP Family Planning Commission still strongly opposed it. The reason is that if the family planning policy is abolished, the first ones to be affected is the CCP's Family Planning Department. Regarding the inaccurate data of China's population census, Yi Fuxian believes there are several reasons. One is that the executors are mostly the former members of the Statistics Bureau, the Family Planning Commission, and the Population Society. They will instinctively keep the population data consistent, otherwise they will be held accountable. Second, the census was officially said to verify the household registration ID. The problem is that China's household registration population is more inflated than the National Bureau of Statistics has published. Since there are more than 20 individual rights linked to the hukou, which is a household registration system in China, people have a strong incentive to obtain more hukou, especially the privileged class, some of whom own more than a dozen hukou themselves for the purpose such as buying houses. Third, census takers' income is linked to the number reported on the census, and census takers do not need to enter households to conduct surveys, so many of them falsely report the number of people to fulfill their greed. Fourth, the local governments want reports of higher populations. China's fiscal system makes many local governments highly dependent on financial transfers from higher levels of government. Increasing population can lead to more financial transfers, more funding for education and medical care, poverty alleviation, and more leverage in securing railroad and highway projects. For example, it is common for educational institutions to misrepresent the number of students to obtain funding for compulsory education, resulting in huge amounts of fake numbers in the published birth and total population. In addition, the health sector has been misreporting births and selling birth certificates, with CCP Media, Democracy and Law Daily reporting on September 25, 2016, that 4,000 blank birth certificates were stolen and sold at maternal and child health stations in Mengcheng County, Anhui Province, where they could be used for household registration. And CCTV reporting on October 24, 2019, that hospitals in several provinces were selling birth certificates for 30,000 yuan. Yi Fuxian said there is more interest in misreporting the number of births and selling birth certificates, so the number of births in the health sector is also inflated. Yi stressed that, because of interests, the population data of various departments in China, including education, health, household registration, and the Statistics Bureau, are all inflated, and these data appear to corroborate each other, but in fact they are contaminated by each other. In order to maintain consistency with the published population data, the original data has been drastically modified by each department, resulting in distortions that would prevent the central government from having access to the real population data, which results in decisions based on false population data. Not only are the statistics reported locally falsified, but the National Bureau of Statistics, which is the final publisher of the data, makes the final tampering after receiving the aggregated data. As an example, Yi Fuxian said that in 2000, the CCP's National Bureau of Statistics predicted that China's population would reach 1.267 billion in 2000. But the 2000 census total was much lower than that, after which there was a so-called official recheck and fill in the gaps, and it became 1.245 billion people. After that, an additional 20.72 million people were added, and then the NBS announced to the public that the 2000 census was 1.266 billion people. The actual fertility rate was 1.22, but it was falsified to be 1.8 by the Family Planning Commission. The 2010 census fertility rate of 1.18 was also changed to 1.63. Why was the fertility rate tampered with? Yi Fuxian said, according to Yu Xuejun of the Regulations Department at the National Family Planning Commission, if the fertility rate was only 1.2, there would be no need for family planning. We have to have a fertility rate of 1.8, so there is still family planning to be practiced, and the officials actually understand that the purpose of falsifying the fertility rate is to maintain the continuation of the family planning policy. But the real population data cannot be concealed for long, he argues, and will one day be exposed. The falsification of population data is a rather large project, which is actually not easy to do because it has to be matched with data from the past years, including the number, age, gender, and regional distribution. If we use supercomputers to do the calculation and audit, it is easy to see many problems. These falsifications we mentioned above may be just the tip of the iceberg, and this falsification problem will eventually come to light to the public. As the final decision maker, this census data was revised for more than a month and finally published as nearly 1.42 billion. The CCP also has a desire to compete for the title of the world's most populous country. If India becomes the world's most populous country, a lot of international capital will flow to India, which has a larger and younger population, and China will be stripped of this role as the world's factory. Currently, the speed of international capital outflow from China has gradually accelerated, although there are various factors such as the trade war between China and the United States, as well as the supply chain transfer. But the decline of China's labor force and resulting increase in labor costs is also a factor that cannot be ignored. Yi Fuxian pointed out that the results of the census and research also shows that the aging, declining birth rate, and non-marriage of the Chinese population has accelerated. In the not-too-distant future, these three major problems will surface, and the population will fall into negative growth. It is one of the largest gray rhinos to China's economic and social development.